The meeting has been live streamed.
Yes.
Okay. Zoor Sahab, I think we are live on YouTube now. Can you check, please? I think yes.
Yes, we are live.
Dr. Mudassir and Dr. Shaheen Shora, are we good to go? Can we start the meeting?
Go ahead.
Okay, good evening and assalamu alaikum to all those who have joined us today for one of our first sessions related to Talk to a Doc. Our first series will be on how to deal with suicidal tendencies or the measures to prevent suicides, which are more prevalent in our society nowadays. JK scientists usually our outreach programs are usually related to more of related to the academics, but as of now we have thought that JK scientists has a role to play as well in with the problems that we are facing in the society. So therefore, we have come up with this special series, Talk to a Doc series. The first edition of this series is about the problems that our society faces, particularly related to the increased tendencies of suicides among our young generations. So today we are being joined by two special speakers who have been with us for a quite long period of time. We have Dr. Mudassir Firdausi, who will be the host for this session, moderating the session also. Dr. Mudassir Firdausi is consultant psychiatrist and he is honorary senior lecturer at St. George's University of London. He's an executive member of the Faculty of General Adult Psychiatry, and he is also interim vice president, British Kashmiri Medical Association. We are also joined by Dr. Shaheen Shora. Dr. Shaheen Shora will be the speaker today. Dr. Shaheen Shora is consultant psychiatrist. She's a regional fellow, Royal Society of Medicine, London. We thank both Dr. Mudassir Firdausi and Dr. Shaheen Shora for being with us today. And to all those participants who are joining us live, either on our Facebook, who will be watching us on Facebook account, or who are joining us live on our YouTube channel. If you have any questions for our speakers, for our guests, including Dr. Mudassir Firdausi and Dr. Shaheen Chora, please feel free to post them in the comment box or the chat box. We'll take up those questions later on. So this session is being moderated, hosted by Dr. Mudassir Firdausi. Dr. Mudassir Firdausi, the floor is yours. Please go ahead.
Thank you, Khalid Saab, and thank you, JK Centers, for organizing this session. So as introduced by Khalid Saab, I am a psychiatrist by profession. So I welcome you all today to this special session where we'll be talking about suicide, causes, prevention, and potential treatments to some extent in next 1 hour. I would like to welcome Dr. Shaheen Shora, as introduced by Khalid Saab. Dr. Shaheen Shora is a consultant psychiatrist in UK. She's been working in psychiatry for a while. She's also a clinical director at the minute in Bedfordshire. Her interests are varied. You can see her talking on various forums about mental health and other issues. And she's very much interested in education of students, trainees, etc. So welcome, Dr. Shaheen Shora. So how the Assalamu alaikum kashir patti wan beke to agar if you are asking questions I will kashir patti kat karit later, but mostly mass mixed language the sorry istiqbal iskar az suicide मतलब का nishun का कोशर लफ्ज I want to easily आपने think translate करें अस छ सारनी पता कि कशीर मज रिसेंटली अखबारन मज बाकी सोशल मीडिया हस पे वारिया न्यूज़ के वारिया ज्यादा छ पन लाइफ एंड करने कोशिश करान या खास कर यूथ अत मतलब क्या सवाल जवाब आज ऑलरेडी क्या सवाल यम डॉक्टर शाहीन शोरा से डिस्कस करे तो we will welcome any other questions you will send through the chat or through YouTube. So Dr. Shaheen Shora, welcome. I will start with one common question, which I think has been commonly, obviously, whenever there is a death, tragic death of someone, because they end their life for for any reason is that people do think why and how it happens. So when we talk about Kashmir, I think we also talk about conflict here. And how common are the mental health problems in conflict zones, and how does it relate to this complex issue of suicide?
Assalamu alaikum, everyone, and thank you, JK Scientist, for giving me the opportunity to be the speaker today. A very, very relevant and important topic, obviously as professional of a huge concern to me because of the increasing trends in Kashmir, our homeland, as Dr. Mudassir said. In answer to your question, Mudassir, obviously Kashmir, as we all know, is a recognized conflict zone. It's the most highly militarized zone in the entire world. And that in itself, creates an environment or a dynamic which is quite unique. And it's not just unique to Kashmir, it's unique to other conflict zones in the world. And it's well recognized that in conflict zones, the impact that it has on people in general, but more importantly, on young people, on women, is quite significant. So if we talk about Kashmir today in terms of what does the conflict zone mean or imply in terms of patients or people's well-being and their mental health. So World Health Organization, which is called WHO, they published a study recently, a couple of years ago in 2019, in the Lancet Medical Journal. And what they said in that, they did research in about 159 countries, a lot of countries, but the studies in total were around 129 studies. And what they concluded was that there is about 22% of people, living in the conflict zone do have some form of a mental illness. And predominantly, these are common mental health disorders. And by common mental health disorders, I mean depression, anxiety, but also in conflict zone, what is unique is that there's a lot of post-traumatic stress disorder, which is also called PTSD. There's also seems to be increased rates of schizophrenia, psychotic illnesses, and also bipolar affective disorders. The other thing that is unique in conflict zones, which I already touched upon at the beginning, women seem to be a lot more at an increased risk and are affected more adversely compared to men. And the trend seems to increase with age. So children, again, bear the brunt of living in a conflict area. But as they grow and as the ages increase, going into adolescence, teenage, young men, young women, they are at higher risk as well. Now, if we break it down further in terms of mental illness, so the mental illness has got grading in terms of severity, mild, moderate, or severe. What is again being shown in this study is that about 9% of this 22% that's affected, they seem to have a moderate to severe impact. So they present with moderate to severe stages of mental illness, and 11% are showing symptoms which we can classify as mild. So that's what happens in conflict areas. There was another report by UN, and they published the report at a similar time, and they took some evidence from this study. And what they came up with was that about 1 in 5 people living in a conflict zone will suffer with some form of mental illness. And that's slightly higher than the general population. So if we look at depression as the most common mental disorder in the entire world, usually it's 1 in 4. It varies between 1 in 3 to 1 in 4, but in conflict zone, it's much higher. Now, when we talk about suicide is quite a complex phenomenon, and it is related more to some mental illnesses. But what I need to emphasize is that suicide or a tendency to self-harm or self-harming behavior can also be present in people who do not have an underlying mental illness. So it's recognized as a public health disorder by the World Health Organization. And yes, there is relationship with mental illness, but it's between 40 to 50%. Not everyone that commits suicide or self-harms or is at risk of self-harm necessarily has an underlying mental disorder. And again, that becomes important given the context of where we are living in terms of our environment, what our other experiences are. And also, it also has an impact on what's happening around you and how that will influence you towards these behaviors. And I'm sure as we go on, we'll tease that out in a little bit more detail. Just to mention one more study, which is called the Global Burden of Depression Study. This was done in 2015, prior to the couple of studies I mentioned. And they clearly showed a positive association between conflict or living in conflict areas and depression and anxiety. So there is a definite correlation. Thank you.
Thank you very much. So a few important points you raised is that suicide is a public health disorder, and it has wider implications than just mental illness. And clearly mental illness is one of the biggest risk factors for suicide. I think that thanks for quoting the studies. I just want to mention briefly that some of the local studies from Kashmir. If people want to look them up, I know the audience here is quite into research. There was one by ActionAid, one by MSF, and there are papers published from the Department of Psychiatry. I was part of one, like community problems of trauma was as high as 65 to 70%. And this study was published in 2008. And similarly, the rates of anxiety, depression are almost double in Kashmir context than outside. So moving on from that, if we talk about the at-risk groups for suicide, and would you say there are any specific groups which are at high risk, and how that plans out when it comes to suicide?
Okay, thank you, Mudassir. So suicide, as I said, it's a global and a public health problem, but there are definitely certain age groups and certain profiles that put you at an increased risk of suicide. And it's quite important to understand that and why that may be the case. So the evidence that is present through research worldwide, but also locally, the age group that's most at risk tends to be men. And these are men usually between the ages of 44 to 54. So that age group is the most at risk. But if we look at the data in terms of the highest numbers of suicide, it tends to happen as a second highest cause of death in people aged between the age of 15 to 29. Again, predominantly young men and boys. But over the last 5 to 10 years, there's also been an increasing trend in females under the age of 25, where the self-harming behavior or attempts to suicide or attempted suicide to completed suicide is more. Now, if we look at the profiling of an individual, as I said, males and young males seem to be the highest at risk. There are also certain things that will put anyone, irrespective of age, irrespective of their financial background, their physical health, that can put them at increased risk. And these are called trigger factors or trigger points in your life where you are at an increased risk, where you may be driven to wanting to harm yourself because of various reasons, usually because of hopelessness or a sense of helplessness. And these tend to be around bereavement. If you lost a loved one, it doesn't just have to be your parent. It could be, a friend that you were very close to, someone that you know very closely. It can be a neighbor. So this can predispose you as well. So losses and bereavement in your life. Second, there's any significant change, and these are called life events. So life events could be, for example, in women when they give birth to children, they are at risk if they either have an underlying illness or develop postpartum depression or psychosis. They are at risk. Then there are people at risk who may already be misusing substances, and they sometimes either planned or impulsively may be at risk because there could be accidental, say, overdose of a drug, which may not necessarily be intentional, but there can be intentional reasons as well. The second important life event is loss of employment, loss of significant savings, witness to a very significant or traumatic event. And these factors can make you quite vulnerable and can trigger you to behaviors that will lead to attempts to self-harm or suicide. The other thing is that if you already have mental illness, there are certain mental illnesses that are more prone by the nature of the illness itself, that can be a positive factor, or the incidence of suicide and self-harm in those mental illnesses is more. The most common amongst those is depression, where the link to suicide is the highest. As I mentioned earlier, about 50% of those people that commit suicide, they seem to have an underlying mental illness, and depression being the most common, followed by substance misuse, and that includes both illicit drugs, over-the-counter prescribed drugs that you're misusing, or alcohol as well. The third, if we look at the order, is anxiety. So these predispose you, again, if you have the mental illness, these underlying mental illnesses, you are more prone, more susceptible to these behaviors or attempts of self-harm. The other thing I think we also need to bear in mind is, what is your access? So if you are having these thoughts of self-harm, how readily are the means to self-harm available to you, and how protective is your environment? Because it's usually a balance between what are the protective factors. So usually the protective factors may be family support, it may be that you are under treatment from a professional, you are taking your medication regularly, you are seeking help readily. So these will be classed as protective factors. When there are less of these, or those are not present, then the balance is tilted, and you then think about factors or environments that put you at risk. So these, could be access to, for example, do you have an access to a rope if you wanted to strangulate yourself, or do you live nearby a bridge where you can jump from, or if you're living in the rural areas or villages, what's your access to pesticides? So these factors in terms of access to means, and how safe or unsafe is your environment is also has a huge bearing. So these are the things, and these are the factors that put you in a higher risk group because of all of these various factors. Now, within a particular individual, and every individual is unique, you don't need to have all of these factors present at once. They can be in varying degrees, or some may be present or some may not be. But it's very important for professionals, for any volunteers who might be doing suicide-related work, for parents, for teachers, to be aware of these profiles or these risk factors in order to be able to see who is at risk. So in summary, it's a combination really of many things put together that can put individuals more at risk compared to other individuals. I hope I answered your question, Mudassir.
You did, Shaheen. So I think just bringing into the Kashmir context, I think we know now that, as established from first question, that there is higher prevalence of mental illness, including depression, so which puts people at increased risk of suicide. Then obviously, when we're talking about economic loss, job losses, or not finding a job, or hopelessness in terms of future and the ongoing uncertainty, so that in turn plays into that higher risk of suicide. And the third important thing is the means to commit suicide, like so where it becomes very important whether people have access to the means, which I think is very important for people to understand. If they know someone who is having these thoughts, or they think maybe at risk, removing the means is very important.
I think in the Kashmir context, Mudassir, if I could just add, Professor Mushtaq Margoob Sahab, he did a Kashmir mental health survey in 2015, and it was quite alarming. He identified conflict, as a main trigger, but he also saw a tremendous increase in rates of depression and anxiety, and again, much more in females. So 50% approximately of females at much higher risk, either presenting with depression or having depression, which is undiagnosed, in contrast about 30% in males. But if we relate it to what is the, worldwide outside of Kashmir, incidents with these things, it's about 36% in females. So we are at a much higher risk, about 50% is much higher. Similarly, males around 21%. But in Kashmir, it's about 37%. So again, depression being a very having an increased risk by the nature of illness itself means that the risk of suicide in proportion is much higher. Thank you.
Thank you. That makes perfect sense. I just want to add a brief question and answer from you. Is in terms of when we talk about risk factors, it's very important to talk about protective factors. And we know from last many years, although Kashmir has been struggling in various ways in conflict and mental illnesses, if we really compare it to the rest of the world and many places where the suicide rate is really, really high, we are still not doing badly. And I think one of the protective factors is religion and faith. And we have seen that most of the religions where suicide is not seen in a good light, it can be a protective factor. But there are other protective factors in, would you think that in context of Kashmir, they play a major factor to keep the rates of suicide low, although there has been escalation on and off, but still those factors need to be reminded?
Yeah, I think, in comparison, say, to the West, East in some ways still has the family unit quite closely knitted together, both your nuclear family as well as extended family. Obviously, with changing times from very large families or extended families, we have become more nuclear. Irrespective of that, we still continue, children live with their parents. They continue to live with their parents even when they are married, which is in, total contrast to, say, in the West. So you are, in a way, offered more support at an emotional level. You are offered more support also at a societal level, because there could be good relationships, say, with neighbors. You could be linked to your local mosque. You could be part of a community. Which is a significant protective factor, because in the West, what's identified as one of the causes that can cause depression, more so, as patients age, and I'm an old age psychiatrist, so I see that in the elderly population, loneliness, bereavement, loss of a family member leaves people very, very vulnerable, irrespective whether or not they have mental illness. So most definitely, I think, the message would be that we need to look after each other and don't lose that sense, that warmth, that purpose of those close-knit connections and close-knit families and communities. The second thing is religion. So when we talk about protective factors, yes, there are these protective factors which are external to you, your family support, or you've got a job, or, you're financially secure. There's also something called your internal resilience. How well equipped are you to deal with problems? Because life in general, life is a trial. Wherever you may be living, there are ups and downs, and human beings have been made to adapt and to be able to cope with difficulties, but also be able to then sustain beyond that difficulty and overcome those difficulties. And in terms of the internal resilience, I think your faith, yathas kashir purchna anan tawakkul ya iman chutai. Zaruri chun ki tu esi wariya mazhabi, tu esi 5 waqt namaz paran ya har waqt masjid maz gasan, magar yus tuhun ye bunyadi yaqeen chu Allah Ta'ala's pet. Be yathas chuanan ki tawakkul, whatever comes my way, it's Allah's will, and I believe in that. Chahe supat tuhandi khatra mushkil cheez aase ya kah jaan cheez aase. So acceptance asin yosti chu variya akh tahi divan na so manto tu taqat zindagi sitan ladne khat. Again, this thing, is quite significant in the Eastern cultures. Also in some, cultures in the West where they, for example, Roman Catholics, they are still very practicing or they have this. And they will tell you, my patients tell me, I will never do a doctor because I will go to hell. Ki mich asan ye pai ki bunasa ye as varia last step dunya mein ye. They believe in afterlife, they believe in all of that. So most definitely, I see panunchu religious protective factor. It's faith, it can be different religions. So it's a protective factor because hope that things will improve because of that belief, that tawakkul, that it will, improve. So most definitely, we should try and maximize those protective factors and remind ourselves, remind our children, our youngsters, and really create those open discussions and opportunities where we are almost understanding our faith as a routine of living, not as a separate thing. Thank you.
Shukriya, Shaheen. Just to add here, because we have seen some reports in newspapers and other places where people get judged after, unfortunately, they die because of suicide, and usually the sin is brought into it and other things. I think we have to remember that suicide is a very complex issue, and none of us, even the doctor who is treating that patient, actually doesn't know the actual cause at the end why they did it. So passing that judgment in the name of religion is itself sinful, because we exactly don't know their intentions at the time and where they even understood their action. Lack of capacity takes. So that's very important. So the another question I had is that many people, sometimes mostly females, youngsters, they would keep self-harming, or they would say we have taken overdoses and they are taken to emergencies or casualty. And then many people think that, well, they're just seeking attention and just cry for help and there's nothing going on with them. And how should society deal with such individuals who seem to be needing help of some kind, but get into this cycle of what would some people call challenging behavior even?
I think it's a very interesting question, and you already talked about a little bit about it in terms of us being very judgmental. So fatwa karan pass. I have actually seen very sadly even professionals, including doctors that I know in very senior positions. Social media spectrum jawan and and it's very disrespectful, not only to the dead person, but you are also disregarding the entire family. And this blaming culture, ki ya such upbringing, you was these are all very criticizing behaviors, but also they are very destructive. They are not constructive, because you are almost blaming either the individual who's lost his precious life, and also the parents, who may have sacrificed everything to bring up a child to the best of their ability. Most parents will do that. I think it's quite, it's very rare that, you will not bring your child up to the best of your capability. Obviously, there are some variations, but that's a very, very small proportion. So we have to be very non-judgmental. We have to have a very open mind when we are facing young people who may be, indulging in self-harming behavior, or who may be making attempts to self-harm. So we have to start with acknowledging what are their fears, what is driving them to these behaviors. We have to understand from their point of view, is it sadness, is it despair? What are the reasons that an individual would be driven to such an extreme state of behavior that they are trying to harm themselves? we need to provide reassurance to these youngsters, and we also need to not dismiss their problems. Majority of the patients, yeah, majority of youngsters, खुदकुशी च करान या खुदकुशी करने की कोशिश च करान, the majority of them will have, as I said before, either an underlying mental illness, yeah, diagnosed, yeah, undiagnosed, or they may be going through difficulties in life, and difficulties can be wide-ranging. You know, it's bereavement, alcohol misuse, relationship breakdown. Another thing that we need to acknowledge in Kashmir as well, times have changed, we have moved on. You know, having a girlfriend, a boyfriend, who very broad, was not so taboo, yeah, unusual. These are, you know, quite, no, I wouldn't say necessarily, but there are more and more people, you know, open to the idea of having relationships. And parents need to understand that as well. But to us, a relationship breakdown, even, you know, they might not be mature enough to deal with it. For example, 15-year-old will not have the same capability, both mental or psychological or emotional, to deal with a relationship upset. You know, family members, you need to support them and don't dismiss their problem. Self-harming behavior and there is someone that's presenting either to A&E or you know, parents to private clinics, you have to do a thorough assessment. The thorough assessment is what is this individual presenting with? You know, what is their background? Why are they coming to me now? You know, how is this happening? So you have to, in a way, try and find an answer to all these questions. You know, medically, we do a mental state examination. We try and see what their thought process is, what their intent is. Sometimes it may well be just a cry for help, but you also have to understand what is driving that. Why are they indulging in this behavior, even if it's a cry for help? Underlying mental health disorders in which not necessarily suicide, but self-harming behaviors will be more. And we see them more in emotionally unstable personality disorders, sometimes also in you know, youngsters who may be misusing drugs. So there are planned attempts. There could also be impulsive attempts where there's no planning and something triggers and drives you to that behavior. So understanding and doing a thorough assessment is absolutely important. And as I said, please, whether you are a professional, you are their parent, you are their teacher, you are their friend, please don't be judgmental. Try and put yourself in their shoes and try and understand what is driving them to this behavior. You need to really listen and you need to encourage them to talk. If they don't talk, if they don't tell you, you wouldn't know. So talking, psychiatrist, which maybe they have a good relationship with their mother. You know, that could be a starting point to talk to someone. But otherwise, you have to be very explicit in answer, you know, asking them all the questions. After that, you know, these children, definitely there is something not right, then you have to signpost them. You have to provide them adequate support. Signposting, again, mental health helpline is Zurat. Counselor, which one do they need to go and see a psychiatrist? And I know, you know, our own colleagues who work in mental health services there, they are doing a tremendous job. Magar reality chi ye problem chu badan mental illness, which the our resources may not entirely match with what we have in terms of the health service per se. So we have to look beyond. Involve, you know, be it the voluntary sector, NGOs, yeah, SP training button focus. Obviously, that's not part of your question, but I just wanted to, you know, touch upon it in terms of what we can do, because we have to look beyond just the presentations and we have to see these children through that difficulty and see how best we can support them.
Indeed. So thank you very much for that. So I want to I think people who do self-harm, is basically to sort of find out why it's happening. I think it's very important to remember as well is that self-harm itself, recurrent self-harm, increases the risk of completed suicide. So it's one of the risk factors in itself. So people who self-harm, if you compare them to general population who don't, they are at much higher risk of completed suicide. And it can simply be sometimes accidental, even if they just wanted to self-harm and they don't mean to kill themselves. But because they may do it in a way where it's not possible to revert back to the safe, action. Somebody trying to put a rope around their neck or cut their wrist or take some pills, and they may end up taking more.
Yeah.
Your issue, Shahinja Savanat, is that abuse in children, particularly young, they can present as self-harm. They may not tell anyone that they are being abused sexually or physically or emotionally. So it's very important to be cautious and try to find out and not dismiss it. Yes, go on, please.
No, I just wanted to add, in terms of this important risk factor. So patients or even general public that self-harm, the studies that we've done here in UK and data from the Office of the National Statistics shows there's 29% of patients who will go on to complete suicide have recently attempted self-harm. So take it with quite huge significance that these children who are self-harming, they are at a much increased risk of completing that suicide. And again, it's present across all age groups, but the most vulnerable are the age group of 25 to 34. For various reasons, we can go into that later on, followed by 35 to 44. So we have to be very, very careful when anyone, is presenting with self-harming behavior or suicide. Thank you.
So talking further about suicide, we all realize that there is a lot of stigma, first about mental illness, then when it comes to suicide, there is an increased stigma and hesitation, both even in professionals, doctors, anyone. So it's something we don't want to talk about for various reasons. And most people sometimes think that if they talk about suicide to someone, if they ask them a question, would it make them worse? Would it increase their suicidality, or would they increase their ideas of suicide? So I think talking about it or not talking about it, do we think there is any relevance at that? And how accurate are these beliefs that if you talk to people about suicide, it may somehow make it worse or make it better, both ways?
I think one of the important things from the perspective of Kashmir is we have to bust a lot of myths. One of the myths around, suicide or self-harm, which is not only in Kashmir, but the general perception in public throughout the world, is that if you talk more about suicide or, if you ask people questions, those especially that are at risk or are self-harming, there is more tendency for them to then self-harm. It's absolutely wrong. There's no evidence in that. In fact, as I said, if you don't ask, you wouldn't know. And these people are in such turmoil, both emotionally and psychologically, when they are contemplating suicide, that even if, you give them some little hope, a platform confidentially where they can talk, they actually will be relieved that someone is extending that hand of help. So this situation yat urdu partna sawanan tinke ka sahara. Somebody is almost drowning in that thought process of having lost hope, feeling helpless. And even if you give them that little flicker of hope, that may be a determining factor in them seeking help, not seeking help, committing suicide or not committing suicide. Sometimes it's a difference of that one intervention, that one conversation. You need to create those opportunities where they are able to express their feelings, where they are able to talk. What was the other myth?
So talking to people about suicide will make them worse. They may do it.
No, it doesn't make them worse. But what I would also say is that if someone is not willing to talk because of various reasons, for example, because of stigma, yeah, you wanan yasa wanan ishu pagal, yeah, and they may have, you know, reservations, or they may not be that forthcoming. In those circumstances and these situations, what is also equally important is to recognize signs of mental illness, or recognizing signs of self-harming behavior. And usually, what you will see is asan amutsan behavior badlav. You know, they may be withdrawing themselves from family, from friends. Agar yaman kun kah cheez of khosh karan, you must ginne gasan ya, you know, you must dostan sid gasan. They stop doing things like that. So you have to also see whether there are any changes in behaviors, or, you know, you know, what is their baseline profiling? Tatman checking change. Agar ka bachos, who was extrovert, who was talkative, and now he's suddenly become withdrawn. You need to understand what's going on. Also, what is the effect on their mood? And this is much more significant in children. For example, agar bullying is gasan school, or a child is at risk of, you know, emotional, physical, sexual abuse, they may not have the confidence to talk about these things openly for various reasons. What you would see is a change in their behavior. They become withdrawn, you know, their sleep, eating cycle changes. They may behave abnormally, they may become erratic in behavior, or become irritable, or become very quiet, you know, and anything that's a change from their normal behavior, you need to look, you know, for signs of that. They most importantly, ye accept karan ki life simple, you know, times have changed. Our youngsters have access to the whole world through internet, social media. And that also sometimes has a bearing on how children will react to situations. And in recent times, because of this COVID-19 pandemic, again, it's an absolutely unprecedented, unnatural situation to be in. And for children in Kashmir, for youngsters in Kashmir, even for that matter, parents, you know, we are coming in a few days to constant, almost like a, you know, psychological lockdown. It's coming up to 2 years. You know, 4th of August was the last time when children went to school. After that, I think they went for a couple of weeks, and then COVID happened. So you have to understand that they are in situations which are very unnatural. And these also have a bearing on how their minds are affected, you know, how their psyche is developing, how their personalities are developing. Because some of them may not even know what's the norm. For some, it may be that, you know, there is no routine, there is no structure, they are aimless, they are trying to look for means keeping themselves, you know, constructively occupied. And that's quite a challenge. Lastly, you observe from a Kashmir context point of view. Sensationalize karani, suicide, self-harming behavior. We have to create awareness, but in a responsible, sensible, professional way. We don't have to do it in a way which is headline grabbing, because what happens at these tender ages is that they tend to imitate behaviors. Yet, usually when I copycat, Adidas t-shirt, or there's a particular hairstyle. It's a similarly driven mentality and behavior when it comes to self-harming behaviors. So we have to be very responsible as citizens, as professionals, but also people in the media, you know, administration, to create awareness. Yes, rightly highlight the problems and the challenges, but at the same time, don't sensationalize it. Respect those families who have gone through this significant loss. Their names, don't publish them. Don't, you know, go into the details of what happened. You have to have dignity and respect for everyone. Actually, media situation, there is an ethics that governs them. And again, WHO, World Health Organization, has given certain guidelines which they have to follow in situations like this. Beginning of year, April, May, suicide, June, June 2021 in comparison to the earlier year or even the earlier months, comparing to even January 2021, there was a much increased attempts of self-harming behavior, because you go into what's medically called a suicide contagion. It's almost gasana. So one person does it, and the other person, if he was very closely known to you, especially, you tend to almost imitate those behaviors. So we have a responsibility on our shoulders to keep our young people safe. Their life is very precious.
शुक्रिया शाहीन तोय कुरु actually उसमें सवाल I'm पत प्रश्न तो media reporting पर just to summarize तो ये वोन मुझे just talking about suicide does not increase suicidal risk, and it may be that golden window where you are talking to someone and you may prevent and save a life in a way. So basically when you talk to anyone about suicide, you have to be very non-judgmental, and you have to talk like you're talking something normal. You know, suicidal thoughts are very common in general population, even in those who never actually tell anyone. So you have to be non-judgmental. If somebody is telling you, just listen to them. Just don't give advice straight away. That is the key. Usually people try those things themselves. Most people are intelligent. They think about it 100 times, 1,000 times, because this is a difficult thought. It's not something easy. People want to end their lives. They have already thought about the options you are going to tell them. So listening is more important than giving advice. Thirdly, I just want to add here is agar toy shubasan tim chukunjai, there is something they can use. You have to make them safe. You have to make the environment safe. And fourthly, get them help, connect them to someone, or be with them for that period of time, because sometimes the intensity of these thoughts can get worse, and that's the time when they do it. And if you are with them and you give them some hope, so they may not get to that phase again. Coming to the media question, I think let us finish that one now here. Obviously, you touched with most of it, and I recently wrote an article in Kashmir Wala, if somebody wants to look at it, in terms of so I am talking, obviously our colleagues from Kashmir are not with who work there are not here, but I have been in touch with them and talked to many of them about it, and I have got the numbers. So I think that this question was commonly asked, why was there sudden increase in Kashmir? And I think if we think about all the other factors, nothing else has changed. They are there. The conflict is there, pandemic is there, Bakayim problem, the only thing which we think, we can't be certain, but most probable thing is you go so sensationalized media, that is TV channels wanna suicide bomb, if you look at some newspaper articles, even the ones who have bigger circulation, really difficult language, and then identifying the person, identifying their family, criticizing their parents, really not ethical, really not ethical. Vishnu Kashmir context is many people are hopeless because of so many reasons. And once they find a hotspot, once they find somebody has been able to complete the act they want to do, timchi karan so pat copy timchi dapan agar yem nafran kor kada partisan what made it. So that was the other unfortunate thing. People gave out addresses where to do it. You know, the mode of yath karlas pad gay so hoitas kor hoim. Yeah, the method was even you'll publish karan article that much asan ya raz asan avezan ya asan tobud ya asan beikin tut chiza, which really can give people ideas. And I think it sounds simplistic, but someone who is just wanting to finish themselves, for them it is a very big deal. Asma Basne. So that is very important, and hopefully I know कि Institute of Mental Health and Neuroscience local administrations, they have given them memorandums that there should be some media guidelines. Obviously, we don't want a media gag either, because that is the other difficulty. But there has to be the question is, why should media report suicide? You know, that is itself a question, and it will take us 2 hours to discuss. But the main idea of reporting is that because it's a public health problem, as we discussed earlier, and by raising awareness, you are stressing on the administration to create more services, create more helplines, not to create sensationalism. If you are creating that, then it's better not to publish it or report it, because it is pointless. Coming to, I think we don't have much. Yes.
Just to conclude, Mudassar, you are absolutely right. Suicide is not a new entity. Suicides were always there. But you very correctly said the only determinant in the context of Kashmir that has changed is this access to media, social media, and the sensationalization of these things. In fact, most of the things that I said, I quoted your article. These were from your article, which is your suicide and responsible media reporting in Kashmir. It was published by Dr. Mudassir Firdausi, and I will highly recommend that to everyone, media personnel, professionals, everyone else. Biaach cheez jus bh yachan chas wanun Kashir hinde lihaz sitin. We are a very small place. Matlab, as agar kun jai chu kiyan gasan, ye chu variya jaldi narik patin phalan. Ye chu prane zamane cha kahawat, when we thought about Kashmir in terms of 7 bridges. Dapan kaim tan chalo thok badsha kadlas. Matlab ah kadlos. By the time it reached the 7th bridge, gaya. Actually, someone said that someone spit in the river. Tiny setmis kadlastan what at one yasa was zanan them sun what them kor khudkashi gaya it became a big a much bigger and false story. So because we are a small community, there are as many rumors, and unfortunately when news spreads, there is not necessarily the same authenticity or the mechanism to release things that are authentic. So we have to be extremely careful in what we tell the general public. Thank you, Mudassir.
Ashim, I'm mindful of time. A few more questions. I will combine them basically now. I think it is important to talk about the warning signs if somebody is thinking about how to identify them. So Guru but already touched a little bit. And also if somebody is having recurrent thoughts, what should they do in that context?
Warning signs of suicide that those people, patients, general population, youngsters, they may either be talking about it, thinking about it, or even in certain situations writing about it. That's important. Second thing, if you talk to them, you will get a feeling that they are feeling hopeless. There's a sense of hopelessness. There's nothing to look forward to. The future is bleak. They feel trapped. There's no way out. But mesa awan jaine manas pet me chuna kahini rood mutan kah tawaka ki kah kari me madat ya I see myself out of this. As I already mentioned, you withdraw. Insan chu gasan badna so afsurdagi manz ya gasan bad quiet gasan khamosh gasan, withdrawing from families, friends, from the community. Changing from whatever their normal behaviors were, stopped playing, stopped. Even nowadays, we have to be mindful that a lot of our youngsters use social media. So you will see that there could be a change in the pattern. Someone who is actively posting, suddenly they withdraw. They are not posting anything. Again, that could be a sign what's going on in their mind. Those that unfortunately may be misusing substances or drugs or alcohol, there's an increase in that. Agar yim letter short niwan dos months yim yutah man niwan ki yim ch behasi asan. Yiman chun hoshi asan na kyanuk na chanuk na kun. Some of them also give away very intimate personal possessions to people that they love. So, for example, agar Bhuvan Panyasyat context, I was very close to my grandmother. I have a shawl that she made. So, if I was to give that away to someone, that's significant. But I say, just to what I say, they give it away. They may also start doing dangerous things. Matlab khasan chatas pet mointav tu yetatne usually yim khasan asan ya kushish karan tim cheez karnik which will clearly put them at risk. Kadlas khasan over the bridge, they'll put their legs across. They may not jump. They are still contemplating. Biaach agar even mental illness as a reason, they usually tend to have what we medically call delusions and hallucinations, but these become almost command hallucinations. So something abnormal because of their abnormal perception, especially in either depression with psychosis or in severe illnesses, they will tell them to do something which is pushing them to harm themselves. a very clear voices come to their head. So they have these persistent thoughts. Magar kun sachi meetan traumatized rasan that they will actually start saying it themselves. So you have to be very vigilant when this happens. Kun sach asan, especially in mental illness, you will have delusional beliefs. You will feel everyone is against me. You become very paranoid. You feel persecuted. Again, in the context of emotionally unstable personality disorders, but also in children who suffered with abuse, they get these very, very persecutory delusions to the point that they hate themselves. So it's almost like, they will self-harm because they have so much self-hatred because of something that happened to them, not because, they did it to themselves. So these are, some of the warning signs that you will see in patients who may be contemplating suicide. Important factor, recent self-harming behavior. If we have time, I'll give you a very quick example that recently we had a death in my service that I'm looking after. It was a 62-year-old policeman. For the last 1 year, he was having these feelings, he's not worthwhile, he's not as good as the young recruits, and he started to become depressed. So eventually, earlier this year, he took retirement. He said he could no longer cope with it. He was trying to harm himself. So he was with his wife and they were driving and he tried to jump out of the car. He has a family history which he recently came to know that one of his maternal grandmothers had committed suicide. This was never talked about in the family because obviously there was stigma then, 40, 50 years ago in England as well. And his aunt told him this. And he had lost his father last year and his twin sister had committed suicide after the loss of the father. So you can see I'm trying to, build a profile. He's a male, he's just retired, he's out of job, he's feeling depressed, he's feeling worthless, he doesn't feel as able as he was as a young recruit joining. And he's contemplating suicide, he's making an attempt. And sadly, he actually took himself to the woods and he hung himself. Even with the best healthcare system that we have here, we couldn't prevent a death, but that's a separate issue, what happened. But what I'm trying to say, there's usually signs before someone completes suicide. There are attempts, they will talk, they will try and seek help, they will become quiet, they will withdraw and all the rest of it. Thank you, Mudassir.
Time is nearly there. Just few more questions we can quickly go through. Obviously, you just to summarize, I think the bottom line is you think if anyone is not feeling emotionally well or they have difficulty in life, there is a possibility of suicide here, and we have to be cautious. Number two, in Kashmir context, I don't think we have time, is the drug abuse, and sometimes young men die suddenly, and we don't know why they died, and it's often that they took an overdose unintentionally because they didn't want to even die, but they still die, which is another big risk factor. I think lastly, I wanted to talk about, obviously we know suicide is preventable. That's why we're having this discussion, or if you look at literature. And even in UK, they are trying to have zero suicides, at least in hospitals. They're aiming for it. So a little bit about what are the steps to prevent suicide before we come to, I think there's a hand raised by Zahida to come for a question.
I think we need to make mental health as popular and as common as physical health. So we have to start from creating awareness around mental well-being. Mental health is as important, and I think, as a professional working in mental health services, I think it's more important than physical health. And in NHS, the National Health Service you and me work in, we say there's no health without mental health. Because if your mental health is affected, your mental well-being is affected, your functioning as an individual, your contributions, as a family member to the society, as an employee, it all is affected. So it has a significant impact. So the starting point should be, we should use all forms of media, social media, radio, TV, news channels, mosques, to increase awareness and to make mental well-being our priority. When we make mental well-being our priority, then we can talk about mental health and preventing, becoming mentally unwell. And in prevention, the most important thing in Kashmir is to tackle stigma. When we make things as common as, going to the baker, we have to make mental well-being and mental health so common that everyone, will know about it and why it's important. That's one thing. Dayam cheese show, again, my appeal to teachers, to friends, to parents, please try and spend time with your children. Observe what's happening in their lives. Take interest. If you are giving them a gadget or a phone, what are they doing with it for 12 hours? You need to know that. You need to know who they are mingling with. You need to know how they are spending time. Are they, getting into any difficulty? Why are they getting that difficulty? So you have to be more interested than ever before in your children, because they are exposed to a whole range of things in a big wide world than ever before. After that, obviously, I think the responsibility, say, in terms of, the community or the society, whether we create volunteering groups through the, non-governmental organizations or even governmental organizations, where there will be places where there will be almost like these hubs where young children and men and women and everyone can go to seek information, to seek help. And then you can signpost them to, resources that will help them, like mental health services, psychiatrists, psychologists, all of those things. So it's a stepwise process, but I think everyone in the society has a role to play. And the most important thing I would like to say, in all the studies that have been done in the conflict zone, Kashmir doesn't even yet feature in them. You the studies, Syria, Somalia, Nigeria, Iraq, Yemen, all countries. The two, interestingly, two places that don't appear in the conflict studies is Kashmir and Palestine for various reasons. So what I'm basically trying to say is that we need to ourselves, create a platform, because external help is minimal, minimally accessible from outside for Kashmir. So we have to create those internal platforms and internal means of resilience. The individual level of please give your children those life skills, make them resilient, give them opportunities, not just academics. Create venues for them to have recreation in a constructive way. They don't fall, into the trap of these drugs or dangerous behaviors. Plus, always give hope. There's nothing, in life that is too difficult to ever overcome. So always, instill that hope, do the positive reinforcement at whichever level you are. Don't just talk about despair, don't just talk about sadness, don't just talk about problems. Look at things in a different way, change your perspective. Because even in the midst of a conflict, in whichever countries that I, spoke about, difficulties create opportunities. So let's not lose sense of that and sight of that. And most importantly, life is very precious. We need to look after our children, our young people, our adults, our elderly people, and all of us have a responsibility for that. Thank you.
Shukriya, Shaheen. So I think if anyone is interested, they can look at like physical health, mental health. You can go through the stage of primary prevention, secondary prevention, tertiary prevention, and these documents are freely available on WHO website. And I think prevention as much, Shivan, as a society, how we talk about it as well, the language we use, how the media reports it, because that's considered one of the biggest risk factors now because of social media, more so in children. I think we discussed most of them already. Suicidal behaviors. If someone tells you they are suicidal, what should we do? Like I said, listen rather than advise, make them safe, get them help. I think that is the message. don't try to sort of, if you are not feeling comfortable dealing with it, don't try to sort of say things which may like agar to itiman simply when you should gona karun, it may not be a good thing to say because they're already feeling guilty about it, you know. So just stay neutral, that kind of thing. I think Dr. Zahida Kamri has a question or a comment.
Thank you so much. It's just a comment, and I appreciate your time. And this session was really helpful, I think, for our people back home. But I wanted to reiterate this thing that stress for doing better in life is more, I think, on our students back home, and that may be one of the reasons that they are having mental issues. But thankfully, like the suicidal tendency is not that much. We should be thankful to our society as such, or the close-knit family ties, as Dr. Shora already said. So I wanted to give an example of Simone, the Olympian who talked about mental illness. So she is at the peak of her career, but still, because of the mental health issues, she couldn't compete and just withdrew. So we should keep in mind that like being at the helm of affairs always is not going to happen, and we have to move on with life. And JK Scientist is always there if they want any help, and they can, like, we need to engage all our students in different activities, and that's why we want our students to be like associated with any volunteerism anywhere in Kashmir that's going on. That will keep their mind like if they have multiple things at their hand, I don't think they will have that thinking that they will do something different, like this suicide. So I think we should have one more session like this, and where we will have a greater participation from our audience in future. And I thank you, Dr. Shahin Shora and Dr. Firdausi, for your time.
Thank you. I hope we were able to discuss some of the issues. So I would really like to say that it's very important for all of Kashmiris, whether in Kashmir or whichever country we're on, to collaborate, work together like we are doing here from UK and states and Kashmir. And I know we wanted to have friends and psychiatrists from Kashmir in this session, but for various reasons, which we may not be able to discuss here, things are a bit difficult in terms of getting permissions to speak publicly and other things. So we apologize for that, but we are constantly talking to them. We're working with them, so we kind of know the ground situation, and we're looking for further online webinars for mental health, drug addiction, and other issues in future as well. And I just want to thank Dr. Shahin Shora again for taking time and answering our questions today. Thank you. Back to you, Khalid.
Thank you, Dr. Mudassir Firdausi and Dr. Shahin Shora, for being with us today. So before we wind up this session, I would like to have final comments from you, Dr. Mudassir Firdausi and Dr. Shahin Shora as well, that vis-a-vis this problem, mental health issues or suicidal tendencies, how would you like us, JK scientists, to play a major role for our societies? I mean, what would you like to do for JK scientists to do, or how would you be of help so that we can be of help to our society?
So as I said, I think collaboration is very important. We are probably most of us professionals, and I think we can contribute in whatever way, maybe that knowledge or helping people to sort of even, you're helping people to get apprenticeships or get fellowships or jobs. That sometimes is also helpful, because sometimes it's the lack of job or lack of opportunity which may be hindrance. I think at the same time, I think I already said words matter, discourse matters, how we talk about things matter. I think that's very important when it comes to mental health, suicide, stigma. So we have to be very mindful of our language, what we use, being non-judgmental. There was a article in Greater Kashmir which was calling it as social menace and other things and sins. I think as educated and professionals, I think our role is to change that discourse and change it in a positive way, so that we are creating awareness, not creating stigma. And I know it's not easy. I use the word commit suicide so many times, but I know how loaded it is with the history. We don't have time now. So I think my message would be non-judgmental, be there, try to help. Try not to sort of think that you know everything and you are the final word. None of us are. We are. We can contribute in our small ways. I think we need to work with people back home because they are fighting it at the front, which is more important. We need to let them be in the front, and we need to support them rather than tell them what to do. Because essentially we are in safe spaces as we are now than where they are. Shukriya.
Dr. Shahin Chora, please.
Shukriya, Khalid. I would first say that in terms of seeking help, many doctors across the world, the mainly diaspora, but also doctors from Kashmir, we run a 24-hour helpline called Dial a Doctor. And if someone is struggling, for example, especially if it's out of hours when you may not be able to access the doctor or, even speak to a family member who may be asleep, there are these helplines available. The number for that is 1-800-889-2729. And there are psychiatrists as well as, general medicine doctors, but all specialties that are available. And if you have no one, please dial this number and speak to them, because it's very important to understand that in these situations, the particular person may feel very lonely, may feel very helpless. So they need to have a means to reach out. That was one. In terms of your question, Khalid, I think, this session in itself that we are working collaboratively and we've been able to hold this is one way of us working together. What will also help is maybe doing a survey with young people, students in Kashmir, to ask them what may help, because they will guide us in identifying what are the difficulties they are facing rather than us preaching what we know. It could be that they would want specific sessions on mental well-being, mental illness. They may want us to run workshops. I don't know, but I think they will be the people who can guide us the best as to what needs to happen. Dr. Mudassir is also very, very actively in touch with mental health professionals and mental health services back in Kashmir. And we need to find whether there are opportunities, because there definitely is a need for more collaborative working. We did, talk about suicides today and self-harm in general. But the other very, very worrying thing in Kashmir, which I think is an unseen pandemic at the moment, which is, I think, emerging into a pandemic, is drug and substance misuse amongst our youth. And again, you can't just brush it under the carpet. No one is immune when this is happening in your society. And we need to, actively do something about it together. Because again, that's something quite significant in terms of how adversely it affects your physical health, your mental health. You lose your dignity, you become dependent, you become, functionless. And it's a very vicious cycle to fall a trap into. And unfortunately, from drugs and substance misuse, apart from how adversely it affects the individual, their family, and their loved ones or carers, it also creates a cycle of crime, of violence, of aggression, and it becomes, a perpetuating cycle, which is very difficult to then break. So that may be another area that we could all, together work on. The British Kashmiri Medical Association, which Mudassir and I am representing today, and JK Scientists, which all of you here are representing today. But there are other, similar, I won't call them organizations, but groups that could work together and come together. Because I think, one of the reasons we are together is for the love of our homeland. And, that drives us all. So I think we should maximize opportunities and collaborative working and contribute to raising awareness, to learning, to teaching and helping in whatever way we can. Thank you.
Thank you once again, Dr. Shaheen Shora and Dr. Mudassir Firdausi, for being with us today. On behalf of JK Scientists, I would really appreciate and thank that you have given us time today. And with so much ease, the way you have discussed this topic, I'm sure this is going to be of help to our kids back home. And I would also like to trade that we have a dedicated youth wing for JK Scientists. We have a women's sport wing at JK Scientists. We have trained psychologists at with JK Scientists. If you have any issues related to mental health and you want to talk to us, please feel free to write to us. So today, I would like to also thank Dr. Zahida Kamri, Saima Beg, and Dr. Zahur Gul, who are lead coordinators for this series, and Dr. Shaheen Shora and Dr. Mudassir Firdausi. We will I'm sure that we will be having more sessions with you in future, and we have had mental health series in the past, who the videos are available on our YouTube channel as well, and we will have more sessions with Dr. Shaheen Chora and Dr. Mudassir Firdausi. Thank you once again for being with us. Thank you.
Thank you.
Shukriya. Thank you for having us, Khalid.
Thank you so much.